Today we discuss a common health topic that affects many women worldwide: uterine fibroids. These are non-cancerous growths that show up in the uterus, typically during the childbearing years. Uterine fibroids can be as tiny as an apple seed or as bulky as a grapefruit. In some cases, they might even grow larger, enough to make a woman look pregnant. And the number? Well, the number can vary. You might have one, two, or several. Now, it's important to note that although uterine fibroids are quite common, they're not always harmless. For some women, they can lead to uncomfortable symptoms that can interfere with their daily lives. Now, you might be wondering, how do I know if I have uterine fibroids? What are the symptoms? Well, uterine fibroids are interesting because they can vary greatly in both size and number. They can range from so small they're invisible to the naked eye, to large masses that can distort the shape of the uterus. One of the most common symptoms is pelvic pain. This isn't your typical discomfort. It's a persistent, nagging pain that just doesn't let up. Another telltale sign is heavy menstrual bleeding. We're not talking about your regular cycle here, but bleeding that's so heavy it disrupts your daily life. Fibroids can also lead to prolonged menstrual cycles, pressure or fullness in your lower abdomen, frequent urination, difficulty emptying your bladder, and constipation. And in some cases, they can even cause backache or leg pains. Uterine fibroids are generally categorized into three types based on their location in the uterus. Intramural fibroids, the most common type, develop in the muscular wall of the uterus. Subserosal fibroids grow outside the uterus, while submucosal fibroids, the rarest type, grow just underneath the uterine lining. Remember, these symptoms can vary from person to person, and not everyone with fibroids will experience them. If you do notice any of these symptoms, it's crucial to consult with a healthcare professional. The exact cause of fibroids is still unclear, but researchers believe hormones play a significant role. This uncertainty makes fibroids a bit of a mystery, but there's no denying the influence of hormones such as estrogen and progesterone. These hormones, which are crucial for the reproductive cycle, are believed to promote the growth of fibroids. Now, when we talk about risk factors, being of reproductive age is one significant aspect to consider. This is the time when the levels of estrogen and progesterone are at their peak, making it a ripe period for the development of fibroids. It's also important to note that these are not the only risk factors. Other factors such as genetic predisposition and lifestyle choices can also influence the likelihood of developing fibroids. However, having these risk factors doesn't mean you're destined to have fibroids. They merely increase the chances, but they do not guarantee that you will develop fibroids. Although fibroids are non-cancerous, they can still lead to certain complications. One such complication is anemia, which can occur as a result of heavy menstrual bleeding caused by the fibroids. This can leave you feeling tired and weak, making it difficult to carry out your daily activities. Furthermore, fibroids can also have an impact on fertility and pregnancy outcomes. The presence of these growths in the uterus can sometimes make it harder to conceive or carry a pregnancy to term. Preventing fibroids may not always be possible, but there are strategies that can help reduce your risk. Maintaining a healthy lifestyle is one of them. Regular exercise, a balanced diet, and keeping stress levels in check can all play a part in keeping your body in optimal condition. Additionally, certain contraceptives have been found to potentially lower the risk of developing fibroids. It's always best to consult with your healthcare provider if you suspect you may have fibroids. Uterine fibroids are a common health concern, but with awareness and proper care, they can be managed effectively. Remember, they can vary in size, shape, and location, with symptoms including heavy periods, lower belly or back pain, painful sex, and urinating too often. We don't know the exact cause of the condition, but hormones, genetics, and other factors may lead to it. You might be able to lower your fibroid risk with healthy lifestyle changes. Try to stay at a healthy weight, get regular exercise, and eat a balanced diet with plenty of fruits and vegetables. Thank you for watching, and please like, comment, and subscribe if you enjoyed the video. Also, don't forget to hit the bell notification so you'll be notified when we release new videos. See you next time.